Hi, my name is Marshauiona Irvin. I'm doing my informative speech on pediatric dentistry, which is performed by a pediatrician who specializes in seeing kids in children's dentistry.
Oh, wow. So what is a pediatrician?
A pediatrician is a doctor who specializes in kids dentistry. A pediatrician is a specialist who goes to school, dental school for 4 years, and then does an extra 2 years in dental school to specialize in working with kids. So they know how to deal with kids and their behavior and all of their disorders.
Oh, wow. So they only treat children? I don't have to worry about like bringing my child there and they're too rough on them? Because sometimes I go to the dentist and they too rough on my teeth.
Right. So a pediatrician goes to school the extra 2 years to learn how to deal with them and to work with them, to do the procedures differently from a general dentist.
Mm-hmm. I guess, so you answered my question. I was trying to see what was the difference because my dentist is, rougher. What you think?
So when should my child first visit the dentist?
Your child should first visit the dentist when they start cutting teeth. So as soon as they start cutting teeth, they can come in for their first dental visit, no matter if they're a few months or 1 year old. Most people like to come when they're about 1 so they can kind of know what's going on and behave a little better.
Mm-hmm.
So
Oh, wow. So if my child has 1, 2, I need to start bringing them to the dentist at that point.
yes, because at
I
that
didn't know
point,
that.
the doctor can let you know when the next teeth are gonna erupt and what you should expect. Sometimes when kids are teething, they pull at their ears, they have a little bit runny nose, you might change a few extra dirty diapers. Yeah, so he'll let you know about everything.
That's good to know because I just thought he was sick when he was doing that.
Yeah, and sometimes parents think that the child might have an ear infection, but it's just that they're growing their new teeth in the back, and you have nerves that run through the back molars that is really close to the ear. So when you see them pulling at their ears, it's really their teeth sometimes.
Oh.
And what would the doctor check for?
So the first visit, the doctor would check for cavities, any abnormalities, any malformations, the TMJ joints, the soft tissue, everything in the mouth.
Wow.
So if your child has a small cavity, then the doctor might suggest fillings. Medium cavity, maybe a crown. But if the cavity is too large and you wait too long to bring your child to the dentist, then that's when they have to get teeth pulled. And you want to try and save all the teeth that you can.
Oh, wow. So how often, like after that first visit, when they first start cutting teeth, should we bring them?
You should bring your child to the dentist every 6 months because it takes about 6 months for a cavity to form.
Oh, so that's why the 6-month rule is, oh, wow.
And when they come in for the 6 months, they will get their exam, cleaning, and x-rays.
That was about to be my next question. When they come in, like what all does the doctor check for? Like on a normal office visit, what do they check for?
They check for cavities, anything that's not normal, and then they're going to treat it.
Okay, okay. Now, what, but you had a question about the
Thumb sucking?
Yes, my child sucks her thumb. So I was wondering what could you all do?
Okay, that's something, we can do something about that. So if your child sucks their thumb, his or her thumb, then we have something called Mavalistop. It's like a polish that they can put on their fingernails. So you don't just want to put it on that one thumb, you want to put it on all their fingers because sometimes it'll taste nasty and they'll stop sucking their thumb and they'll move to a different finger.
Wow.
Or go to the other hand. So you put it on all 10 fingers and sometimes it doesn't work and you want to just revisit it, keep trying it, and if that doesn't work after a certain age, then you want to go ahead and get what is called a thumb sucking appliance. So the thumb sucking appliance is a little appliance that goes in their mouth. We just glue it on to their back teeth, and it has these little prongs in the front that prevents them from putting their thumb in their mouth, and they can't pull it on their palate to suck their thumb. So when they put it in their mouth, it's just gonna feel a bunch of metal, and it'll be really uncomfortable for them.
wow, to suck their thumb, wow.
So I do have a question. My child's teeth go from the front of her upper teeth. Would she need braces?
Are you saying that her bottom her teeth are misaligned, the bite.
Yeah,
The bottom go in front of the top.
the top. Yeah.
Oh, okay, we have something for that as well. So we have what's called a Frostbite Appliance. So if your child's bottom teeth go behind, the bottom teeth come in front of the upper teeth, then we have what's called the Frostbite Appliance. So we would put little buildups on her bottom teeth to open the bite first, which is, we do this in the office. It's just like getting a filling. It doesn't hurt. They don't need to be numb or anything for it.
Okay.
So it opens the bite first, and then we put the appliance in, which push the front teeth forward. And this is something that could avoid braces in the future.
And that's what I'm thinking about, how much braces are.
Right.
Yeah, braces are really expensive. They can start from anywhere from $4,000 to $6,000. But with braces, if your child needs braces, we have what's called phase 1 or phase 2. Phase 1 braces when the child has kind of like mixed intention, which is when they have some of their permanent teeth with the primary teeth.
Okay.
So once the permanent teeth start growing, then we can kind of tell if the child will need braces or not. And that will be a phase 1 if they need it with the mixed intention. Phase 2 is when they have all of their permanent teeth, and then they'll need braces. And sometimes some kids may need phase 1 and phase 2.
Well, and that's what I was about to say. So how will we know, I guess, before the missed intentions happen with the permanent and the primary teeth, if we're gonna need braces? Like, is that something we need to start saving for now, based on what you find, or like, how will we know?
You can definitely start saving for braces or even getting insurance. Some insurances pay for braces, some don't.
Oh, see, we need to know that too. Because I don't know what Walmart offers. Now, my last question, I don't know how many questions you have, but my last question is, like, it's hard for me to get my child to sit still. They don't do well with procedures.
Yeah.
As soon as they get in the chair, they going crazy. What do you guys have for that? Because I don't want people in there, like, holding my child down and stuff. So what procedures you use?
So we have a few different methods for that.
Okay.
So first we have where we just get them numb with local anesthesia. So we just get the tooth or the mouth numb in whatever specific area that the child needs work in.
Okay.
If you think that your child is not going to behave, depending on how well they behave, we can do the nitrous gas, where we just put the little nose on them and they breathe in the laughing gas and it relaxes them.
Okay.
If they're really bad, then we also offer sedations. Sedations are usually done by pediatricians with kids. So with sedations, it's very important that your child does not eat or drink the night before or the morning of the appointment. If your child eats or drinks before the appointment, it's a chance that they could vomit and swallow it back into their lungs, and they could possibly choke or, really hurt themselves.
Wow.
It's also important that they get a good night rest, and you don't use any words that are not child friendly. Like, you don't want to tell them that they're getting a shot, they're coming in to get work done. Just kind of bring them in, let them think it's a normal dental visit, and we just give them a little sedation medicine, which is Demerol and Vistarol, 2 meds that we mix together, and they come in, they drink that, and they're going to wait about an hour. So we're going to come in, drink the sedation medicine, they're going to wait about an hour, we'll send them back up to the front, and we'll call them back to come in the back. Now, once we give them the medicine, your child might look like, oh, this is not even helping, she's still running around, still playing, but it's a combination of the sedation medicine and the nitrous together that does the job. So that's what really relaxes them. And they may fall asleep, but the medicine does not put them to sleep. We don't put any kids to sleep. We want them awake. We don't want to put your child to sleep for fillings or a dental visit and then your child not wake up. We don't want to take that risk. And that's something that a pediatrician learns in dental school.
Okay.
So, and then if that doesn't work, you can put them to sleep if it's something that's very severe and that you think that they would really need to get done. And we have hospital visits where we'll do the dental work in the hospital.
I didn't know that. So you said the pediatricians?
Yes.
The pediatricians would actually go to the hospital, or do they have pediatricians at the hospital?
Well, some pediatricians leave from their private practice and go to the hospital, and then you have some that work in a hospital setting.
See, that was my concern, because I would want my child to be familiar with their doctor, so
Right.
I would want that pediatrician to come to the hospital rather than my child going in there as a brand new doctor. You know?
Right.
So I appreciate that. It's good to know. Yeah, we have a lot to think about, and
Thank you so much.
yeah, everything that we're looking at seems like your answers. So I appreciate you, Ms. Irvin. Thank you
You're
so much,
welcome.
and I think that we'll be bringing her in for her first visit,
Yes.
and every 6 months thereafter.
Right.